Vulnerable population groups. Despite decades of outlining healthy people goals in the United States, significant differences in health outcomes still exist across population groups due largely to the social and physical determinants of health. Determinants of health and nutritional status. According to the Office of Disease Prevention and Health Promotion, health is determined by several factors: policies and laws, social factors, health services, individual behaviors, and biology and genetics. The interrelationships of these factors determine individual and population health. Thus, an ecological or a comprehensive approach to disease prevention and health promotion is needed. Policies and laws made at the institution, local, state, and federal levels affect individual and population health. Let's look at policies and laws. Policies and laws can involve regulating food labels, tax on sodas and junk food, tax on bottled water, and vending machine content and locations. They also may include dumping of harvested crops by farms versus distribution to the needy, national nutrition programs, and meatless Mondays, for example, at schools, hospitals, and work sites. Social factors. Social determinants of health reflect the social factors and physical conditions of the environment in which people are born, live, learn, play, work, and age. Social determinants of health impact a wide range of health, functioning, and quality of life outcomes. They are also known as social and physical determinants of health. Social factors that might affect nutritional status include long-standing practices and policies that impact access to resources and healthcare, low income, the cost of food, availability of and access to healthy foods, access to mass media and technology, the quality of education in schools, transportation, cooking skills, culture. And the physical determinants might affect nutritional status and include food options at the work sites, schools, etc., recreational facilities in neighborhoods, conditions of the homes for cooking and storing food, condition and safety of neighborhoods for physical activity, and barriers to people with disabilities. Also, exposure to polluted water, soil, and air. Health services, access to health care, availability of quality health care, long-standing policies and practices that impact access to resources, and cultural and linguistic competence. Additionally, lack of healthcare professionals from underrepresented communities, the cost of healthcare, and the lack of health insurance. Individual behaviors, diet and eating habits, exercise and physical activity, food safety practices, hand washing, and alcohol, cigarette, and or drug use. Biology and genetics. The age and stage of the life cycle, sex or gender, inherited health conditions, family history of disease, and geographical clustering of certain diseases. Vulnerable population groups. The term special population refers to a group that is disadvantaged financially, socially, economically, politically, physically, or mentally. On the other hand, the term vulnerable population is inclusive of special populations, but is used more often within a health context. Traditionally vulnerable groups include pregnant women, lactating or breastfeeding women, infants, young children, older persons, the chronically ill, and those that are mentally and physically disabled. The stage in the life cycle makes some of these groups vulnerable. The inability to take care of oneself due to illness, immunocompromised status, and physical or intellectual ability make some groups vulnerable. Traditionally vulnerable groups, according to CDC, include American Indians, Alaska Natives, Asian Americans, Blacks or African Americans, Hispanics or Latinos, Native Hawaiians and Pacific Islanders, rural and urban residents with limited resources, migrants, immigrants, and low income residents. The historical, economic, and other social contexts make some of these groups vulnerable to poor health outcomes. More recent vulnerable groups. The more recent groups involve those that are food insecure, homeless, and those with HIV. Additionally, the current lead poisoning issues is very big. For example, the water crisis in Flint, Michigan, and lead paint in other water supplies across the country. This is a concern because with lead poisoning, the lead gets into the bones and can also cause intellectual and physical impairment because lead also crosses the blood brain barrier. Tuberculosis, especially the drug resistant strain, the homeless population have a higher rate of tuberculosis. And also, we see high rates of tuberculosis due to overcrowding in prisons. And also, we see that there's a small percentage of people with HIV/AIDS that also have tuberculosis. The COVID-19 pandemic has left some people vulnerable due to what we sometimes call long COVID. Homelessness. Homeless individuals are those who are displaced and unable to obtain permanent replacement housing. And sometimes you see a new term called the unhoused. But homelessness is on the rise. And according to data from 2024, 18% is the national homelessness rate. Additionally, when we look at the homeless population, 30% of homeless families have children. The causes of homelessness include lack of affordable housing, limited scale of housing assistance programs, poverty and decline in public assistance, catastrophic illness and healthcare cost, addiction and mental illness, and domestic violence. The health status of the homeless is compromised by the lack of adequate, safe, and sanitary housing. Additionally, the homeless are susceptible to hunger, food insecurity, weight loss, upper respiratory infections, and a weakened immune system. They are also at increased risk for infectious disease like hepatitis, tuberculosis, and HIV/AIDS, as mentioned previously. Many also suffer from mental health issues. HIV/AIDS. According to data from 2022, about 1.2 million Americans have been diagnosed or are living with HIV/AIDS. And interestingly, about 13% of the population is estimated to be undiagnosed. HIV has a disproportionate impact on racial and ethnic minorities, gay, bisexual, and other men who have sex with men. HIV and many of its treatments can change the body's metabolism or the way the body processes nutrients and other substances like body fat. And the drugs used to combat these diseases also restrict nutrient availability and utilization. Persons with AIDS are susceptible to many types of infection, including illnesses from foodborne pathogens, which puts them at high risk for severe illness or death. The three types of bacteria that are particularly concerning are Salmonella, Campylobacter jejuni, and Listeria monocytogenes. So, when you look at what the symptoms of AIDS HIV are, they include nausea, vomiting, diarrhea, lipodystrophy or body fat redistribution, insulin resistance, weight loss, wasting syndrome, protein calorie malnutrition, esophagitis or inflammation of the esophagus, and oral lesions. So you can see when you look at these symptoms that they do put these individuals at high nutritional risk. Thank you for watching.